Welcome back, and I hope you do get tested for breast cancer, or screened for breast cancer. Is important. The month has not ended yet, and of course this entire month is dedicated to breast cancer, but also on the 10th of this month we marked World Mental Health Day, and that's not only been the conversation we've been having about our health care. In fact, throughout the year there's always something that we need to mark in order to remind people to take better care of their health. And unfortunately, a lot of people have been complaining, especially in Ghana, that they are not able to access healthcare, quality healthcare, either because we may not have the facilities, but even if we do not have the equipment, and for many people it's just too expensive. And that is where the issue of universal healthcare or health coverage comes in, because again, I mean, when you look at the SDGs, it says clearly from 3.8 that there should be universal healthcare for everyone. And I'll just read a bit of what it says and why it's important that we have this conversation. So it says that the health targets for the SDG 3.8 aims to achieve universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. That is not the case, unfortunately, for many people in Ghana, many people in sub-Saharan Africa. And it's even more worrying because a study has indicated, and this study was conducted, by the way, from the Institute of Security Studies, that there's likely that possibility that Africa may not be able to meet its SDGs. And COVID is even going to exacerbate it more. And so how do we ensure that there's quality healthcare and it's also made available to everyone, so that even if they do not have enough money to pay for it, they can still access healthcare? Luckily, we know that when it comes to breast cancer, cervical cancer, they are covered by the National Health Insurance Scheme. But what about childhood cancer, which unfortunately is not covered by the scheme, and a number of other diseases as well? To help us with this conversation, we have the CEO of Nationwide Medical Insurance, Nancy Ampa, and she has a decade experience and more in health insurance, having been part of the National Health Insurance Scheme from its inception, and a few other things as well. She won a number of awards. We'll touch on all of that, but she joins us in the studio this morning. Good morning.
Good morning.
How are you doing?
I'm good, and you?
I'm sure you screened already. I mean, of course, you find yourself in you know, the medical field, so you would know that. But let's talk about universal health coverage and why it is important for everyone in Ghana to have access to healthcare.
Okay, universal health coverage, simply put, what you read was a bit technical, but simply put, it means that everybody should have access to healthcare when they need it, irrespective of where you stay, how much your income is. When you need healthcare, you must have it. Healthcare is not... Going to hospital is one part of healthcare, but healthcare is a whole gamut, right? From getting access to information, how to prevent yourself, how to take good care of yourself, how to prevent certain diseases, how to keep your surroundings clean. All that is healthcare. So it is not a far-fetched idea. It's not something that people in UN or something sat there and did, but it's something that is really practical, something we need to be doing as for ourselves.
But that's the problem, because a lot of people complain that even though it's something we need to do for ourselves, I mean, when you fall sick and you go to the hospital, you either have to pay so much money, and even eventually rich people who treat chronic diseases become broke because you have to pay so much money over time, and you empty your coffers just so you can, you know, access healthcare, and it becomes a problem for many of these people.
That is why there is health insurance. It's the best way of healthcare financing that has emerged over time. Health insurance is simply saving for a rainy day, which we all do. It is making sure that when you need the healthcare, you don't immediately need that amount of money to deal with it because you've been contributing to this. And it's actually a pooling of resources. So you're going to get pooling from everybody. It's a group of people. You all contribute. Definitely, all of you are not going to be sick at the same time. So when one person needs it, that person is going to have the healthcare that they need without it, you know, disrupting your work, selling your car, selling your, using up your capital and stuff like that, so that the tomato seller does not have to lose her capital just because she fell sick. The taxi driver doesn't have to sell his car just because he fell sick. So that is why health insurance is the best way to mitigate these.
But then if you talk about that, someone sitting somewhere might think that once we talk about universal health care, then it means it should be free. I mean, I should gain access to treatment of any disease and not have to pay a dime about it. But clearly from your explanation, it's not entirely free.
It cannot be free.
It cannot?
There's no free lunch. What we're saying is, even if we are paying, if you even take the, where the state comes in, there are taxes that subsidize these things, so it cannot be totally free. But what we are saying is that it should bring equity, so that we're able to, it's based on ability to pay, and you don't need to, it's not equal, it's equity. So that I pay a bit more. Those who can afford to pay more pay a bit more. So depending on your income level, you pay what you can, and together it is put into this big kitty, and then whatever you need will be done for you.
So regardless of how much I pay, especially if I belong to, the poorer population, I can still gain access to healthcare at all costs.
Exactly. That is the whole essence of universal healthcare. So that we are all contributing according to our ability, but when it comes to healthcare, you get exactly what you need.
Is that not unfair to people who will be paying a lot more?
That is, our society is like that. I mean, that is the culture we have. Really, when your auntie is sick and they call you, you would have to cough up the money.
Yeah.
But if you had bought health insurance for your auntie, then you would not have to cough up that much money at any time. We already have a culture of supporting each other. It's the same principle. It's not a new thing at all. So universal healthcare coverage is not a new thing. When a village comes together to make sure that a particular person's daughter is, taken care of, that is making sure you get universal healthcare. When we say universal, it looks like it's a big thing. We are thinking about the whole world.
Yeah.
But really, if you live in a little community, that is your universe.
Okay.
That little community there is your universe. And if you're able to make sure that everybody there is healthy, and it starts from knowing what to do, cleaning your surroundings, making sure you don't fall sick, not getting to early detection. You were talking about cancers. All that, if you detect cancer early, you don't have to spend so much because early detection, the treatment is easier. So once you have access to healthcare, and it gives you peace of mind knowing that once I am sick, I can go to hospital anytime. We won't wait till it's really bad before we eventually go. Then it won't become that expensive.
I like that you're talking about cancer, and I just want to bring children in because when it comes to the SDGs, children also play a key role in that as well. Now, unfortunately, in Ghana, we're told that children who suffer from cancer do not benefit from health insurance. And we've talked about that quite a number of times on this show, where we've had companies come and ask people to donate so they can give that money to these children who are suffering from cancer. We've had mothers who've come to ask for support because they just could not afford paying for their children to undergo treatment. And so it's a big worry. I mean, breast cancer is covered by National Health Insurance Scheme. We have cervical cancer and a few others. But when it comes to children and cancer, they are not. That's a problem, is it not?
Well, it could be a problem, but at Nationwide, we do cover childhood cancers.
Okay.
As part of the benefits that you get. Cancers are covered irrespective of whether you're an adult or a child. And I think, again, the whole cancer thing becomes expensive because we don't do early detection. So most mothers will keep the children at home for a long time, but they'll be treated for the wrong thing. They are giving herbal preparations because there is no money to go to the hospital. But when you have health insurance, with the smallest thing, we are not talking about abuse, but with the smallest thing, you should be able to go to the hospital. Once it is detected early, we wouldn't have to keep it till it becomes such a big deal, and then we would have to come and, look for funds. Again, sign on to a private health insurance, and some of these things will definitely be covered for you. What
then is the role of the national insurance with regards to creating awareness for breast cancer?
National insurance?
Yes.
Or nationwide?
Nationwide insurance, pardon me.
Okay, we created quite a bit of our, we also had a whole series of activities in October. Together with our healthcare service providers, there are lots of free screenings. We've had webinars and seminars on health, on breast cancer. We even do some of the screening on site for the corporate entities. So you don't have to leave the office to go. So we set up a little thing there. Then you go and you get tested. So we've done quite a bit of it.
What about mental health awareness?
Mental health, we did the same thing. That was on 10th of October, right? Yes. We had a webinar where we spoke all about mental health. Mental health is not the way we see it as, really mental, but it's really little things. Sometimes having people to talk to. The effect of COVID, even on mental health, is quite huge. And when we had the webinar, there were so many questions about that. Because people, life had changed for people and people had to adjust. So we do quite a bit of that. And again, mental health is a benefit on our scheme.
I see. But back to the issue of breast cancer, I just want to find out, with the screening and the awareness that was created, did we detect quite a number of cases?
There were not too many, but I'm yet to get the details because the month has not ended. Once the month
so
ends,
it's still ongoing?
It's still ongoing.
Okay, so where does this screening happen for nationwide? I mean...
it's happening in more than 40 places.
I see.
Yeah.
Oh.
Total House Clinic, in Yahoo Medical, in Kumasi, in Koforidua, everywhere. Anywhere we have
good
service
then.
providers.
And it's absolutely free.
Yes, please.
Okay, so I mean, if you're watching right now and you're looking for a way to benefit, this is your cue. Maybe we'll give you more details as to where exactly you can go so you can also get screened for breast cancer, because Nationwide Medical Insurance is also providing free screening for everyone. But even before we go, I mean, talking about universal health coverage, what exactly is the NMI doing to ensure that it reaches everyone?
We're trying to use our existing social structures, like the welfare schemes we have. Most people join associations because they would benefit, they have some welfare thing that they would benefit from. So now we are ensuring people's health through the associations as groups, so that if you're in a church and you're in a women's fellowship or something, you already paid dues. So you cede part, we don't want an extra burden on you.
Okay.
So you cede part of that dues, and that ensures your health. So that instead of being a second women's fellowship coming and giving you a 200 CDs, we can take off your health up to, say, 1,000 CDs or 2,000 CDs. You take all students' associations, I'm sure you are one of one, and every other day there's something we should be contributing to. And depending on how popular you are, you could get 10,000 or you could get 1,000 CDs.
I use a different name.
So what we do is we are reaching out to these associations as well. They also usually pay dues, so you cede part of that dues, and again you get, it becomes fair. Everybody gets about the same thing when they have any such situation, and then we take care of the sick ones to a certain level without coming back to the association to collect money from people and all that.
Where can I find Nationwide Medical Insurance, by the way?
Our office is at near the Akwaje interchange.
Okay. Okay,
so
should be easy.
Next to 19 Independence Avenue, technically.
Okay, should be easy then if we want to get in touch with you. And also on
There's
social
a website,
media.
We have social media.
Tell us all about that. I mean, the website, what is it officially?
www.nationwidemh.com.
Nationwidemh.com.
Yeah.
What would you say to everyone who's watching, especially for those that you'd encourage to undergo breast cancer screening?
I would say early detection helps. Health insurance is a good way of financing your health care. You should sign up onto a health insurance scheme, in this case nationwide.
Yeah.
And it gives you peace of mind. It gives you security knowing that your health is covered. So you don't worry too much about things. And at the time that you need the help, we will come through for you. We keep our promises. We are very particular about that. We have more than 600 service providers, hospitals, clinics, dental, physiotherapy, everything. So you'd always have somewhere to go to. We have been thinking of branching into telemedicine to make it more accessible to people, because why buy health insurance if you cannot see a doctor? And whether we like it or not, government cannot provide a perfect system for it. But there is the enabling environment to make all these things happen. So we go with that.
Well, we're looking forward to that. Thank you so much for speaking to us. And just to reiterate, Nationwide Medical Insurance and what you're doing to support people who go through catastrophic health conditions. How do you support that?
To begin with, like I said, if you have health insurance, you might not get to the catastrophic stage. So we try very much not to get things to get to catastrophic stage, by encouraging people to go for screening. Preventive healthcare is very important. Screening, annual screening, which is a benefit on our scheme. So you get screened and anything is detected early. But should you even get there, there's this concept of critical illness cover. It is not that expensive. So with as little as 10 CDs or so, you can actually, a month, you can sign up on critical illness. Critical illness is strokes, cancers, kidney failures, liver failures, all those things.
And you contribute just 10 Ghana cedis a month?
Yes, because the incidence is not so great. If you compare how often you get a kidney failure to how often you get malaria, that's where the difference is. So
I see.
So that it needed to be expensive and it needed to be catastrophic.
Definitely. And so 10 cedis a month, that's all that you need to contribute, I mean, for that particular one. I'm sure that when you get in touch with them, you'll get all the other details as well. Thank you so much for speaking to us. Nancy Ampa is the CEO of Nationwide Medical Insurance, and she's won quite a number of awards. Congratulations, by the way, on those ones. We're looking for the next one. Maybe we'll follow you so you can pick up the award and we'll celebrate together. But thank you for speaking.
Thank you.
And we have Mensa joining us for some entertainment. We'll also bring you some more updates with regards to what's happening in the world of entertainment. This is TV3 New Day. We'll be right back.